So very good morning, one and all. I am Dr. Prashant Tiwari. Today we will discuss about a receptor and how drug is acting with a particular receptor. So as we know that what is a receptor? So a receptor is a free sites which are present in a cell membrane or either in a nucleus. So when drug can bind to the receptor, that means when site will be free, a receptor will be free. So if n number of drugs are there and there is a competition to bind the same site, so there will be the competition. So who can bind the site? Which drug can bind the site? So that means those drugs who are potent, who are more efficacious, then only those drugs can bind to the site. So there will be the competition. So as you know that there is a different kind of receptors like GPCR receptor, ion channel receptor, ligand gated ion channel receptor, voltage gated ion channel receptor, competitive reversible, non-competitive, reversible, non-reversible. So that means there will be the competition to find the same site. So a receptor is the specific chemical constituents of the cell with which a drug interaction will be done and to show the pharmacological response. And some receptor sites have been identified with a specific part of proteins and nucleic acid. And in most cases, the chemical nature of the receptor sites remains obscure. So a receptor, as I rightly told, it is a free site which are present in a cell membrane. So any cellular macromolecules that a drug binds to initiate its effect. So before going to understand a detail about the receptor, you should know how drug can bind, which can bind, who can bind. So drug is a chemical substance that interacts with a biological system to produce a physiological effect. And very interesting thing I wanted to tell you, all the drugs are chemical, but not all chemicals are drug. The ability to bind the receptor is mediated by the chemical structure of a drug that allow it to interact with a complementary surface on the receptor. So once bound to the receptor, an agonistic activity will enhance the cellular activity. For example, agonist action on drug that binds to the beta receptor in the heart will increase the force of myocardial contraction. And in addition to that, any drugs that will bind to the alpha receptor on blood vessels, so it will increase the blood pressure. So finally, the binding of agonistic often triggers a series of biochemical events, which will ultimately leads to the alteration in a function of desired response. So how drug will act? So drug will act by the three mechanisms: enzymatic inhibition, drug receptor interaction, non-specific interaction. So what is happening in case of enzymatic inhibition? That means when any drug acts within the cell by modifying the normal biochemical reaction by enzymatic inhibition, it may be reversible or non-reversible, competitive or non-competitive, competitive, and very rightly approved. So there will be a competition. When there will be a competition, when there so competition means there are drug substance willing to bind the same site. So there will be a competition to occupy the same site. So those drug substances who are more potent, then only those drug can bind to the receptor. They can only remain in the competition to occupy the same site. Like antimetabolites may be used with mimic the response, so they can mimic the activity, mimic the responses. Gene function may be suppressed. So it is due to the enzymatic inhibition. Now coming to the drug, it is subject that means drug will interact response. So drug act on the cell membrane by physical or chemical interaction. And in such cases, some receptor sites have been identified with specific parts of proteins of certain nucleic acid, like most of the chemical substances, they will occupy the receptors to show the desired response by binding the site. Non-specific interactions means drug will exclusively bind with an outside the cell, that is the it will act at the extracellular membrane. So always sodium remains at the outer extracellular level. So these sites include external surface like skin, GIT. So in case of GIT, that antacid we can consider. So antacid, they will neutralize the pH. Apart from that, we should also know when we talk about the receptor and drug interaction. So there are the factors, certain factors which can hamper the drug responses, like affinity and intrinsic activity. These two factors we should know. So what is affinity? Affinity means it will measure the tightness of drug that drug binds to the particular receptor. And intrinsic activity means it will measure the ability of drug once bind to the receptor to generate an effective activity, which is either they can stimulate or produce changes in cellular activity. They will there will having a certain modulation at the intracellular level. So these are the certain factors which are involved in a receptor mechanism usage. So that's it for the day. And tomorrow we will have a discussion on different categories of drug which are binding to the particular site. Thank you all.